Every parent recognizes that late-night cough, the one that makes you worry about your child's health. Is it just a passing illness, like bronchitis? Or could it be something more serious, like asthma? Asthma, if not managed properly, can become a life-threatening condition, while bronchitis is usually less severe. I'm Dr. Richard Montgomery, and in this video, we'll help you understand the key differences between these two common childhood respiratory conditions. Let's begin with bronchitis. This condition is an inflammation of the bronchial tubes, the airways that carry air to your lungs. It is usually short-term and often follows a cold or respiratory infection. Asthma, in contrast, is a chronic disease. The airways become persistently inflamed, narrow, and can even become severely obstructed, making breathing difficult and sometimes life-threatening. Unlike bronchitis, which usually resolves within weeks, asthma requires ongoing management and can be life-threatening if not controlled. Understanding these differences is crucial for providing the right care and knowing when to seek medical help. The main triggers for asthma in children often come from our environment, especially air pollution. Polluted air, filled with smoke and tiny particles, can irritate sensitive airways and trigger asthma attacks. Infographics and animations help us see how pollution enters the lungs, causing inflammation and narrowing of the airways. Genetics also play a role. Children with a family history of asthma or allergies are more likely to develop asthma. To help protect your child, avoid outdoor activities when pollution levels are high and keep windows closed on smoggy days. Asthma is becoming more common in children, and one major reason is the increase in air pollution in our environment. Children who live in cities with high pollution levels are more likely to develop asthma or experience more frequent attacks. Air quality can change with the seasons. Spring and fall often bring more asthma attacks due to pollen and pollution, while cold winter air can also make symptoms worse. To help protect your child, check local air quality reports and try to keep them indoors when pollution levels are high. Avoid outdoor activities during high pollution days, and remember that children living near busy roads or industrial areas are at greater risk for asthma symptoms. Understanding what happens inside helps explain the symptoms you see outside. In bronchitis, the bronchial tube lining becomes inflamed and swollen, producing excess mucus. This narrows the airways temporarily, causing that productive cough as the body tries to clear the mucus. With asthma, three things happen. The airway muscles tighten in spasms, the airway lining becomes inflamed and swollen, and thick mucus forms. This triple threat creates the characteristic wheezing and breathing difficulty. The symptoms can seem similar, but there are key differences. Bronchitis typically presents with a persistent, productive cough that brings up mucus, mild fever and fatigue, chest discomfort or soreness from coughing. Symptoms that gradually improve over 1-3 weeks. Asthma symptoms include wheezing, that high-pitched whistling sound when breathing, shortness of breath, especially during activities. Chest tightness, like someone sitting on their chest, coughing, that's often worse at night or early morning. Symptoms that come and go, triggered by specific factors. While we're focusing on children, it's important to note that asthma often begins in childhood, before age 5 in many cases, but it doesn't always stay in childhood. About half of children with asthma will continue to have symptoms as adults, though they may become milder. Some children appear to outgrow asthma during adolescence, only to have it return later in life. Proper management during childhood can significantly impact long-term outcomes. Here's a critical point. Both conditions can lead to complications if not properly managed. Bronchitis, especially if severe or recurring, can sometimes progress to pneumonia, a more serious lung infection. Asthma, when poorly controlled, can also increase susceptibility to respiratory infections, including bacterial pneumonia. The already inflamed airways become an easier target for bacteria. This is why managing the primary condition is so important. Recognizing the warning signs of severe asthma can save a life. Asthma attacks can become life-threatening if not treated quickly. Seek emergency care immediately if your child has severe difficulty breathing, is unable to speak in full sentences, or appears exhausted. Watch for lips or fingernails turning blue or gray, or if a pulse oximeter shows oxygen saturation below 92%. This is a critical warning sign. If you see the skin around the ribs pulling in with each breath, or your child becomes confused, unusually drowsy, or panicked, act fast. Rapid worsening of symptoms. or no improvement after using rescue medications means you should call emergency services right away. For immediate concerns, stay calm. Your child will pick up on your anxiety. Have them sit upright and breathe slowly. Use prescribed rescue medications as directed. Remove them from any obvious triggers. For ongoing management, keep a symptom diary to identify patterns. Follow medication schedules precisely. Monitor air quality reports. Maintain regular checkups with your pediatrician. Ensure your child's school has an action plan. Schedule a regular appointment if your child has recurring breathing problems. Coughing persists beyond 3 weeks. They're using rescue inhalers more than twice a week. Symptoms interfere with sleep or daily activities. You notice a pattern of symptoms with specific triggers. Go to the emergency room when breathing becomes severely labored. Your child can't walk or talk normally due to breathlessness. Rescue medications aren't providing relief. You see signs of cyanosis, that blue or gray skin color. Your instincts tell you something seriously wrong. Trust them. Trust them. I'm Dr. Richard Montgomery, Maryland. As we close, let's review. Bronchitis is usually short-term and resolves with supportive care, while asthma is a chronic, more serious condition that requires ongoing management. Asthma can be life-threatening if not properly managed. Watch for warning signs and seek medical help if you are concerned. If you notice any red flags, seek medical help immediately. Never hesitate to contact your doctor or visit the emergency room. With the right care, children with bronchitis or asthma can lead healthy, active lives. Stay informed, stay prepared, and always trust your instincts as a parent. Thank you for watching. Remember, your vigilance and partnership with your child's doctor make all the difference.